Hi, everybody. Nice to see you, and thanks for inviting me here. My background is more in fiscal decentralization and decentralization policy than in PFM. I started getting more interested in PFM a few years ago and co-authored a paper in the IMF volume that came out, I don't know, 5 or 6 years ago, on how PFM reform and decentralization reform could be more closely aligned in particular countries. But what I wanted to talk about today was something that I've been working on for the last couple of years, which was more about how the flow of subnational finances might affect service delivery. And I worked on a project with the Overseas Development Institute, and we were originally going to look at a broader set of countries in a number of sectors. And because of the pandemic and our inability to do field work, we decided to focus on the health sector, and we looked at 4 countries in Africa. So we didn't actually include any countries in Asia in the first stages of this work. And what was most shocking to me is how little I understood about the mix of resources and how they flowed in different intergovernmental systems. And it made me raise questions about what is even a budget. And some of these things came up a bit in some of the comments, and especially some things Yulia said about the subnational PFM. But what we basically found was, yes, there are off-budget issues, and often those off-budget sources of revenue that flowed into a particular sector were not included in the PFM process. But even things that were included in the PFM process, you had some funds that came in the form of transfers from the Ministry of Finance, some from a Ministry of Local Government or a Ministry of Planning or a health ministry. And often those things had different levels of conditionality on them. Those funds sometimes flowed through an intermediate tier of government and on an unconditional basis, which then got to decide how the money went to lower levels or to frontline service delivery facilities. In some cases, funds flowed around an intermediate tier and directly to local governments. And in some cases, they flowed around all levels of government, from a national government ministry down to the frontline service delivery facility, a health center or a hospital, even when the local government or the state government was in charge of the budgeting and the management of the finances for that facility. And so it really, and some of these resources were unconditional, some were conditional. Sometimes you had multiple sources of revenue for the same thing, say salaries and wages or medicines or something like that, and not enough for other things. And there was nothing the local governments or the frontline service delivery people could do about this, because the resources were conditional, either because of what a central ministry told them they had to do, or because of the conditions that a donor placed on something and gave neither the central ministry nor the intermediate tier of government nor the local tier of government nor the frontline service delivery facility control over how to spend these resources. So, I mean, to some extent, I think that we certainly, in looking at subnational PFM, we look at what's on budget and what's off budget. But I think that we're not looking enough in many countries, I believe, at how the exact flow of resources, whether it goes from a national government ministry to an intermediate tier of government, a local tier of government, or to a service delivery facility, we're not looking at how how those resources flow, who has control over the way they flow from one level to another, when in some cases they're unconditional and in other cases they're conditional. How the conditions that donors place on these things affect this. And this has huge implications, not only for how resources for service delivery flow through the system or not, but it also has implications when there are cases where there are different levels of discussion, of discretion, where we saw in Ethiopia, for example, that there were big differences in states because state governments delivered these resources down to the local governments and the frontline service delivery units in different ways and using different regulations. And this led to inequities. It led to overfinancing of some things, underfinancing of other things. So I know this sounds like a mess, and I don't want to discourage people, but it is a mess. And if we're going to understand how PFM is used to improve service delivery, improve development, improve the quality of life, we have to understand these flows. We have to understand who has control over these flows and how restrictions on these flows are productive, or in some cases, perhaps the lack of discretion, either in budget formulation or in the use of resources when they hit a level of government or a frontline service delivery unit that's delivering services. If we don't understand these things, then there's a lot of what's going on really isn't telling us much about how the flow and management of finances is affecting service delivery. And I'll stop there, because I could go on and on with this. And again, I don't mean to be discouraging. I just think that sometimes when we're looking at the mechanics of PFM and how it's managed at the local level, maybe we're not looking enough at the details of these flows of resources and who is making decisions about how budgets are formed and executed. And these things can be very important for delivering public services.